God, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. Some of you may recognize this as the Alcoholics Anonymous Serenity Prayer. They say that's at the end of every meeting, and it's to have inner peace and the freedom from substance use and the peace of mind as they go into the next day or the next week till their next meeting, that peace of mind and that freedom from substance use. We're going to talk about substance use disorder, specifically within veterinary medicine. Within vet med, we have drugs and substances at our clinics that can be used and misused in substance use disorder. The description of substance use disorder is the use, misuse, overuse, or abuse of a substance containing alcohol, medication, legal drugs, and illegal drugs. Use is using a medication or a drug for something that's not diagnosed. You're using it correctly, but it's not diagnosed for you. Misuse is not taking at a correct time or the correct amount. Let's say you are taking a drug 2 times a day. So the first day you take it that 12 and 12, morning, night. The next day you may take it 36 hours. The third day maybe you take it 6 hours apart. So you're not using it correctly and not following the label. Overuse is a higher dose or higher frequency, and abuse is that dependency. It can be a disorder by itself or as a co-occurring disorder used as a self-medication or numbness. Those co-occurring disorders include anxiety, depression, ADHD, bipolar, PTSD, and schizophrenia. Substances can be put into your body by smoking, drinking, eating ingestion, inhaling, injection, or snorting. Drugs and substances available that can be used or misused. Alcohol, marijuana, cannabis. K2, spice, bath salts are synthetic cannabis. They're dangerous because of the unknown additives. Usually it's marijuana and things are mixed into it, and those are unknown. Barbiturates, benzodiazepines, and hypnotics, which we've studied in pharmacology. We know that they are central nervous system depressants and to relax. Meth and cocaine is a high, a boost of energy. Club drugs like ecstasy, Molly, MDMA, and roofies cause sedation, confusion, memory loss. Hallucinogens like LSD, PCP. Inhalants include glue, paint thinners, corrective whiteout fluid, felt tip markers, gasoline, cleaning fluids, and household aerosols. Opioids include heroin, morphine, codeine, methadone, oxycodone, which we know are painkillers, and that's the opioid crisis that the media talks about in the US. When I say drug in this presentation, I also mean substance. I'm going to use those interchangeably. I'm going to focus on vet med, drugs and medications that we have available, but know that any of those risks can be substances, and any of these substances can be at a risk to use and overuse and misuse. These are the vet med drugs that we have available in most of our clinics. We have the controlled drugs and the non-controlled drugs. Controlled drugs are usually in a lockbox. They are recorded of how much you use, how much is left in the bottle when you buy a new bottle. All of the controlled logbook then goes to the state, and you have to write all those down. These controlled drugs include your opioids, your analgesics, and your anesthetics. Your opioids are right up here at the top: the fentanyl, methadone, morphine, hydromorphine, and oxymorphine. They are a class 2 controlled drug, so that means they have a high potential of abuse. Your anesthetics are here: tilazol, ketamine, diazepam, and they are also in the lockbox and logged. Your non-controlled drugs are down here. For example, gabapentin and trazodone are usually not in a lockbox. They're usually out in general pharmacy where you can grab for appointments. Symptoms and effects of substance use disorder: it's going to affect both the biological, the medical of yourself, behavioral, and social. It's going to affect multi aspects of your life. It's going to vary greatly based on the substance and misuse. So what are you using and how are you using it or misusing it? You can have symptoms of feeling sick, headache, nausea, vomiting, red eyes, mood swings, a high or euphoria, and then on the other end, depressed, sedation, and numbness. Abnormal behavior includes relationship problems, problems at school or work, unsafe actions, sharing needles, unprotected sex, thoughts of suicide. Legal problems, stealing money to buy drugs, jail time, possessing illegal drugs. Serious medical problems include seizures, heart attack, overdose, and death. Within vet med, you could be removed or dismissed from a vet tech or veterinary school program, loss of license to practice, legal problems, or fines. And you could lose your job. So not only losing your job, but that loss of license to practice could be huge. That could be your career, to lose that license. Risk factors in vet med. These first couple are general risk factors for substance use abuse. The family history of addiction, mental health disorder, those co-occurring disorders like depression, anxiety, PTSD, peer pressure, and stress are your general risk factors. Vet med has some additional risk factors: increase of trauma, increase in workload, hours at work, increased suicidal numbers. Vets are one of the higher categories of suicide numbers. Low pay, burnout, and compassion fatigue. Burnout is real in this industry, and it's not something to be ignored or not taken seriously. So with all of these risk factors, plus the open availability and access to drugs, this equals a recipe for a bad situation, temptation, easy use, and addiction. So the statistics, according to the CDC, from October 2020 to October 21, in the US, highest amount of drug overdose deaths, 75,853 deaths, were from opioids. Second highest, 66,035 deaths from synthetic opioids. And that goes back to the opioid crisis in the US. In 2015, 1 in 10 veterinarians in the US suffered from serious psychological distress. 1 in 6 vets had suicidal thoughts. These numbers are pre-pandemic. There is not a lot of information, and information still coming out, of 2020 and 2021. I would assume post-pandemic those numbers are higher. In 2014, 1 in 20 employees within a business would test positive on a drug test, marijuana being the most common positive on a urine test, followed by opioids, barbiturates, cocaine, and methadone. In 2015, 30% of vet hospitals did drug testing, 60% of private business, and almost all federal agencies. These drug tests include pre-employment testing, random, post-accident, and reasonable suspicion testing. Of the 30%, 8% of vet hospitals did random drug testing. Of the 8%, 7% of hospitals, the vets were excluded from the testing. So there's not a lot of data of use and misuse in vet hospitals because they're not testing. They're only 30% are drug testing. So that leaves a lot of unknown. 8% of vet hospitals are doing random. That leaves 92% of unknown source and use, misuse of those drugs within the vet hospitals. Here are some case studies. Now these are from human hospitals. Again, not a lot of information is found on vet clinics because they're not reporting that. They're not recording it, and they're not testing. So these are for human hospitals. In 2016, Rocky Allen, 28, a surgical nurse from Colorado, was preparing a CRI of fentanyl citrate for a patient for orthopedic surgery. Took one of the vials of fentanyl and injected himself. Substituted saline in the vial with the same syringe and needle he just used. So he stole the fentanyl, injected himself, and now you have a contaminated, dirty needle, injected that into the saline bottle, drew up his saline, re-injected that back into the fentanyl vial. So now you have both the saline and the fentanyl vials contaminated because he used the same needle for both. So you have both things contaminated. As many as 2,900 patients may have received saline contaminated with his blood. Those patients were receiving saline as their primary pain medication during the orthopedic procedures instead of the fentanyl. So those people who were going through an orthopedic procedure, a serious, painful procedure, were actually getting saline and needed that opioid, needed those painkillers, that's fentanyl, and they didn't receive it. So not only was the saline and the fentanyl contaminated, but now you have people who need that medication and aren't getting it. These cases are very, very similar, and again, human medicine, human hospitals. In 2008, Ashton Diego, a nurse in Colorado, accessed a fentanyl dispensing machine as many as 25 times in one day. 290 people affected with contaminated saline or tap water that they thought was fentanyl treatment. Again, both the saline and the fentanyl treatment are contaminated. Was sentenced to 4.5 years in prison, in federal prison. In 2013, David Kowalski, a hospital worker in Arizona, had stolen fentanyl syringes, injected himself, and replaced it with tainted saline. Same thing. Saline and fentanyl are contaminated. 39 years in prison and fired from hospital. So pretty substantial consequences of use and misuse. You can lose your job, federal prison, and within vet med that you could lose your license. With treatment, we want to be treating both the substance use disorder and the co-occurring disorder at the same time. Those with anxiety, depression, PTSD, we want to be treating them at the same time, working on them at the same time. This is going to vary depending on the substance use and the co-occurring disorder. What are you using, how much, and when? You're going to talk to your healthcare provider. Therapy, group therapy, and counseling. Like we talked about in the beginning, the AA meeting is a great group therapy. Behavioral therapy is going to include things like not going back to your old stomping ground or not hanging out with your old friends. Things like, I only smoke when I drink. Well, if you're working on smoking, you then also have to work on drinking, and you kind of have to work on both of those at the same time and changing those behaviors, those old behaviors. Prescribed medication, this is actual prescribed medication from a doctor following the script. This is not a self-medication. Treatment and therapy is usually ongoing, involving lifestyle changes and long-term medication. It's not something that you can just fix or cure. You're not just getting over it. You're constantly working on it. These people say things like, I've been sober for 15 years, I've been sober for 16 years, I've been sober for 17 years. It's a constant cycle, and you're constantly working to better yourself. There are help resources available. National Suicide Prevention Hotline is 24/7, and they have a hotline there. Crisis text line, you text HOME to 741-741. Not One More Vet, and here is their icon, is a suicide prevention in the vet community and on Facebook and online. They're a great resource on Facebook. If you don't follow them, you should. It's encouragement, positive stories, and they have CE relating to the suicide prevention. They have a goal to eliminate vet suicide and those vet suicide high numbers. There's also Start Your Recovery. It's an overcoming substance misuse. They have a hotline and online. That is a way to kind of start your recovery, start working on yourself to better yourself. Again, talking with your doctor and talking with your therapist. In conclusion, vet professionals are at an increased risk of co-occurring disorders like anxiety, depression, PTSD, burnout, and compassion fatigue. Thus, they are also at an increased risk of substance use disorder. We pair that with the open and easy drug availability. With the above factors, increased risk and drug availability, us in the vet field need to watch out for each other. See something, say something. If you are worried about yourself or someone else misusing or overusing those available drugs, say something, speak up. Get them treatment, get them help, get yourself help. Get help or use available resources. More research is needed, more data for those number of cases of drug misuse in vet hospitals. They're not testing and they're not reporting vet hospitals, so we don't know. It's kind of unknown how much misuse in vet hospitals. We need to increase treatment, therapy, and knowledge of vet med mental health, and in return, then decrease the risk of both the co-occurring disorder and the substance use disorder. Thank you.